Kolonoscopy consists in filming the inside of the colon using an endoscope with a miniature camera at its tip. Instruments used for either obtaining biopsies or removing polyps are passed through a port in the endoscope. Here are the answers to some questions you might ask yourself about this examination. Kolonoscopy is currently the only valid test for examining the colon if you are experiencing bleeding, pain, or changes in bowel habits. It is the prescribed screening test for all people who might be at high risk for colon cancer, such as those who have already had polyps or colon cancer, or people with one or both parents or close relatives who have had this disease, father, mother, brother, or sister. It is also the only examination recommended after a positive Hemoccult test result when performed as part of the national screening campaign. In case of failure or inability to perform a colonoscopy, a virtual colonoscopy may be performed. In the near future, the use of capsule colonoscopy will also be more widespread. But currently, colonoscopy is the only exam able to discover polyps, even flat or very small ones, and to remove them for analysis. Preparation is an essential phase of the examination. No examination of the colon, whatever the type, can be performed properly without thorough intestinal preparation beforehand. Therefore, before the exam, you must drink an oral purgative to ensure that your intestine is completely clean. Otherwise, residual solid stool might hide a polyp or cancer and may require the test to be repeated. The water that you eliminate must be as clean as drinking water. Some solutions have an unpleasant taste. However, new solutions have been greatly improved and exist in tablet form or with a citrus flavor. Rest assured, your gastroenterologist will choose the most appropriate preparation for you. On the day of your doctor's visit, your gastroenterologist will provide you with a prescription in addition to all required information regarding the exam. You will then have to face any potential inconveniences that exam preparation might create: amount of liquid to drink, unpleasant taste, strict diet. Keeping in mind that this preparation is essential for a successful examination, which you most likely will not have to repeat for 5 years. You may be asked to follow a strict residue-free diet before the exam. The right side, and most importantly, the lowest section of the colon, must be perfectly clean. Your doctor should be alerted of any history of kidney failure or advanced patient age. Some medications must be stopped to avoid cardiovascular complications, such as anticoagulants or blood thinners. You should also closely monitor or stop taking medications to treat diabetes. Provide your gastroenterologist with a complete list of medications you usually take or are currently taking. Do not make any decisions on your own in this regard. You will spend a half day in outpatient care. You must arrive without having eaten anything since midnight. You will first be taken to a cubicle and will then be transported to the endoscopy room on a stretcher. There, the anesthesiologist will set up cardiac monitoring equipment. He or she will insert an IV catheter for injecting the anesthetic. You will be kept under anesthesia for the entire examination, which lasts about 20 minutes. The gastroenterologist will insert the endoscope into the anus and will advance it to the end of the colon, which is called the cecum. Your doctor will then be able to start examining the colon. A bluish dye may be sprayed in order to make flat polyps easier to see. A thin wire snare may be used to lasso and remove any polyps for microscopic evaluation. After the examination has been completed, you will be taken to the recovery room and then to your cubicle, where you will be kept under observation for 2 hours. You will be served a snack. After the colonoscopy, you will be given a full report of the examination, possibly with photos, and instructions for resuming any medications that you may have stopped taking. You will now be able to go home, accompanied by another person. Driving is the only activity that is prohibited after the exam. Over the last few years, the use of new disinfectants, automatic machines for washing the endoscopes, and single-use accessories and small instruments have completely eliminated the risk of contamination, particularly for the hepatitis B and C viruses and the AIDS virus. Consequently, there's no reason that justifies wanting to go first. The French National Authority for Health recommends that a follow-up colonoscopy be performed within 3 to 5 years after your first examination, depending on the number of polyps removed. An early follow-up exam, performed within 3 months of your initial exam, is recommended if a large polyp has been removed. However, if new symptoms appear, especially bleeding, you should contact your doctor earlier. Today, colonoscopy is still the best way to prevent colon cancer.